Clonidine and Guanfacine are two commonly prescribed non-stimulant medications for ADHD. But how are they similar? And better yet, what are their differences? Well, today, we're going to compare them head to head, and by the end of this video, you're going to have a better idea of which medication would be right for you. But before we get started, I want to give a shout out real quick to Neo for this video recommendation. So whenever I talk to my patients about these two medications, the first thing I like to get out of the way is the fact that they typically go by multiple names. So for example, Clonidine is the generic name, whereas Capve or Catapress are the brand names. Then Guanfacine is the generic, and brand-wise, it's either referred to as 10X, which is the short-acting form, or Intuniv, which is the long-acting form. Okay, what does Clonidine and Guanfacine treat? So both of these medications were originally developed as blood pressure medications, with Clonidine first being released in 1966 and Guanfacine in 1986. And then it wasn't until 2010 and 2011 that these medications were approved for ADHD. Then something to be aware of is that both medications are also commonly used off-label to treat things such as motor or vocal tics, agitation, aggression, anxiety, insomnia, symptoms of PTSD, and opioid withdrawal. Now, how do Clonidine and Guanfacine work? So I often refer to these two medications as cousin medications because of how similar they are to each other. Both are considered to be non-stimulants, and this is different than the stimulants that are typically used first line to treat ADHD. So we're talking about meds such as Adderall or Ritalin here. Their mechanisms of action are very, very different from each other. So we know that there are various brain changes in those with ADHD, particularly in relation to the prefrontal cortex and its overall functioning. And remember, the prefrontal cortex is responsible for things such as regulating our behaviors, emotions, and thoughts. Now, both Clonidine and Guanfacine are considered to be alpha-2 agonists, and some of these receptors are found in the prefrontal cortex of your brain. And when these receptors are stimulated, they affect the regulation of the neurotransmitter norepinephrine. So what scientists found was that Clonidine and Guanfacine both enhance prefrontal cortex functioning by strengthening norepinephrine signals. And this causes downstream effects such as inhibition of impulsive and hyperactive behaviors, in addition to enhancement of one's ability to focus. So how are Clonidine and Guanfacine prescribed? Both of these medications can be used either as solo agents or as adjunct therapies to help boost the effects of stimulant medications. Clonidine comes in short-acting tablets, long-acting tablets, and as a skin patch. I typically don't use a patch formulation outside of the treatment of hypertension because the effects on blood pressure might be prolonged and continue even after the patch is removed. And so dosing is usually between 0.05 milligrams and 0.4 milligrams daily, with the short-acting form needing to be taken 3 times per day and the long-acting form taken once to twice per day. Now let's jump over to Guanfacine. This comes in an immediate release and an extended release forms. And remember that 10X is the name for the short-acting version, whereas Intuniv is the name for the long-acting one. 10X has to be taken twice per day compared to Intuniv, which is typically only taken once per day. And when talking about 10X in particular, it comes in a tablet, and the dosing is typically weight-based with a range somewhere between 0.5 milligrams twice daily to 2 milligrams twice daily. Dosing for Intuniv is generally between 1 to 4 milligrams daily. Something that I want to talk about real quick is how to convert from the long-acting forms of these medications to the short-acting forms. A common error that I see being made is the assumption that the dosing between the short and long-acting forms are equivalent. For example, 1 milligram of 10X is equal to 1 milligram of Intuniv, and this is wrong, okay? Around 60 to 75% of the extended release forms of Clonidine and Guanfacine do not get fully absorbed. So when going from the immediate release to the extended release forms, you actually need to lower the dose, and this will help reduce the potential for new side effects from popping up. While we're on the topic of absorption, the other thing to be aware of is that Clonidine's absorption is not affected by food. Guanfacine, on the other hand, is. If you take Guanfacine with a high-fat meal, its absorption increases, and this can lead to worsening of side effects. So just be aware of this if you're taking this medication with food. Now, how long does it take for Clonidine and Guanfacine to start working? What we see is that both of these medications have a delayed effect, meaning that the medication needs time to build up in your system before you start to notice a benefit. Generally, patients report it taking around 2 to 4 weeks before changes are seen. And what we need to do is be a little patient with these medications because this is very different than what you see with stimulants, which work within an hour or so of taking them. Now for the big question, what are the side effects of Clonidine and Guanfacine? According to the FDA medication label, the 5 most common side effects seen in kids and teens on 0.2 milligrams of Capve, so we're talking about the long-acting Clonidine here, were somnolence, headaches, upper abdominal pain, fatigue, and upper respiratory tract infections. The top 5 reported for Intuniv, so the long-acting form of Guanfacine, were somnolence, headaches, fatigue, abdominal pain, and hypotension. Now I want to break some of this down a little further for you. As you can see, both medications run the risk of causing somnolence and fatigue. But when comparing the 2 medications against each other, Clonidine is notorious for being more sedating than Guanfacine. So something that sometimes happens is that after starting a child on Clonidine, parents will come to me saying that their child is having difficulty staying awake in class. What I'll typically do is have the child continue the medication for a week or 2 if possible, and if sedation is still a concern after this time and their body hasn't become adjusted to the medication, I'll switch them over to Guanfacine. More times than not, this concern resolves. Alright, now for the next question. How do you stop taking Clonidine and Guanfacine? One of the biggest take-home points that I need you to leave with today is the fact that both of these medications need to be gradually tapered and discontinued. Neither should be abruptly stopped because doing so can cause something called rebound hypertension. And this is when we see increases in blood pressure a few days after suddenly stopping the medication. And this is even true if you're someone who doesn't struggle with high blood pressure at baseline. So whenever I'm trying to get someone off of these medications, I'll typically decrease Clonidine by 0.1 milligram increments every 3 to 7 days if tolerated, and then Guanfacine by 0.5 milligram increments. But I cannot stress this enough. Please talk to your doctor prior to stopping either of these medications. Okay, before we get into which medication is best, the other thing I want you to know about is the cost of these medications. Both are off patent and have generic forms available, which drives down the cost. And at the time of filming this video, GoodRx shows that 60 tablets of Clonidine 1 milligram can be obtained for around $5 at Walgreens or Walmart, and then 60 tablets of Guanfacine 1 milligram can be purchased for less than $10 at Hy-Vee. So now for the big question, which medication has been clinically proven to be the best? When it comes down to it, I don't think that Clonidine and Guanfacine have ever been compared head to head. But when looking at their individual trials, both have been shown to be effective in treating symptoms of ADHD. Many people believe that they're equally effective, and this idea was supported by a study published in 2018 by Lancet Psychiatry, and it was a meta-analysis that included 133 double-blind, randomized controlled trials. When looking at treatment efficacy, both medications were found to be more efficacious than placebo. And again, this has been shown in multiple other studies to be true as well. And it's worth noting that stimulants are considered to be more effective than both Clonidine and Guanfacine. Their effect sizes have been proven to be large at around 0.8, whereas Clonidine and Guanfacine's effect sizes are around 0.5. So what's my take on all of this? Given that only a few non-stimulant options are currently on the market, these 2 medications are typically the ones that I use most, and that's because both have been shown to be effective in treating ADHD and are relatively well tolerated. I've seen multiple patients have success with both of them, and that's when they're used either as solo agents or also as helper medications to stimulants, right? In most situations when treating ADHD, Guanfacine is my first go-to because of the fact that it's less sedating, and then Clonidine is what I try next if Guanfacine fails or is poorly tolerated for some reason. That's just my personal preference, and other providers might have different opinions and treatment approaches. The other thing to keep in mind is that Clonidine has more overall research in psych disorders that might be comorbid with ADHD. So studies have ranged from treating nightmares and PTSD to self-cutting and borderline personality disorder to mania and bipolar disorder and to irritability and autism. And then because of its sedating properties, many clinicians will use it at bedtime to help with insomnia as well. So there's definitely a lot of benefits to both medications, and it's important to talk to your physician so they can help you decide which medication would be best for you personally. Now, if you're looking to learn more about either of these medications, make sure to click that next video.